are probably live right now. I'm going to go back to my dashboard. I think you guys hear me talking through this. Um, we should be live. I just reinstalled the software because, like, that's craziness. Okay, yep, we're live. I don't know if anybody's gonna find us. No, they'll find us. They'll try to come back in. So let's do this. Okay, why don't while everyone's figuring out what's going on, take us through the rest of this, Jay.
Yeah,
Thank you. Okay.
So I get really just a couple more points, Jay. So if you go forward one slide.
Okay.
And, well, no, I lied to you. 2 slides.
Okay.
So I think, and again, just in English, what does all that mean, right? I mean, we've talked numbers and blah, blah, and what do we do, right?
Yeah, okay.
So in English, what it means is we use a test. It's made by Abbott. This slide I needed to update because it's actually even not accurate anymore. We actually test for the IgG and the IgM. We do both.
Okay.
And it's one test, one blood draw. That it's the same, but we're looking for both. But as I mentioned before, it has a sensitivity of 100%, and it's got the specificity at 99.8%. All tested, all through the FDA, processed by LabCorp. What it means, like I said, if it's positive, you can be confident that 1, you've been exposed. That's the specificity. And 2 is that it was COVID-19, and that's a sensitivity.
Okay.
So a positive result says that. And that's really important to us, is that it's that specific.
Got a great question here, man. Michael Culler, he's been very active in the live chat. So Michael Culler in the live chat, so he and his family had coronavirus.
Yes.
His question is, if we've already had it, how likely are we to get it again?
So that's a great question. And the science is out
Michael.
on that a little bit. And so, was it Michael? Was his name?
Michael, yeah.
So Michael, it was a great question. I'm going to tell you what we know as of, again, June 2nd. As we mentioned before, your body will produce antibodies to any virus. That's the body's immune system reaction. We know previously that the SARS-CoV-1, the old version of this, when 2008, 2009, did provide immunity for 18 to 24 months. It is expected to be the same. It hasn't been around long enough for science to be able to prove that. And so if you go to the CDC website, they will be saying that they can't prove that yet. But that is the way that your body works. That's the way the antibodies work with chickenpox. You get it once, you don't get it again. It's the way the antibodies work with other viruses, and we know with one that was similar to this that it provided immunity for 24 months. They just haven't had it around long enough to prove that. There are 2 studies that are going on right now that are trying to look at what that immunity is going to be. And when you hear things like, Jay, herd immunity, that's what it's speaking to, is that people get this virus, your antibodies are there, and then you can't get it again. And so essentially the virus dies out on itself.
Right, and there's actually been a lot of talk about herd immunity. Because, in fact, I've heard some people say if we social distance, we won't build herd immunity.
There is a lot of thought around that. You listen to some healthcare professionals, and they were saying some of the social distancing was maybe a mistake. But again,
but given a crisis, you go into triage, right?
So that is the answer about immunity. That is actually why, Jay, that folks are getting this test done, because if in fact you have immunity and you've had it before, it really changes things about how we manage the environment that we work in, right? It changes as far as, our ability to face the public. It changes the ability for, our ability to interact with folks. It changes our interaction of things. And so it allows us to kind of have some confidence as an employer. It maybe even changes how and Gina will talk about this a little bit more, but as we look at either a workplace or workplace environment, if we got 10 folks in the office that half have already had it, maybe their exposure to the public is a little bit different. I will say, just to kind of tie up that question as far as immunity, the one thing that also is a little bit unknown and not measured by antibodies is that everybody's body, and they're trying to test this again, they don't have the answer yet, produces antibodies in different strengths. And so while you may have immunity, it also might mean that you might get it again, but at a lesser strain, just depending on how strong your antibody reaction was. And the science is out on that a little bit.
But hopefully the worst is over for Michael and family. I mean,
for Michael and family, the worst should be over. And I think Michael's probably a perfect candidate for getting tested. We had an event today where it was 20 folks. They're bus drivers. And they had us do the antibody draw and had us do their family members also. Quite honestly, their family members all want to get behind the bus so they can start making some money.
Yeah,
because that's been shut down.
Right.
And part of it, Jay, and I'm stealing Gina's thunder a little bit, but it's about confidence in the workplace also, right? I mean, we've been told, if you watch the news or whatever, you go to work and you're going to die, right?
Right.
I mean, and that's what we've
There's
heard.
a lot of concern. I mean, there's really a lot. That's why, I'm glad you guys recommended that we do this show, is that there is so much uncertainty. In fact, it's strange right now. What's happening nationally, I feel as if coronavirus almost didn't happen.
Right.
Like, well, June's here, it's expired, right? But it's not. It's alive and well.
Yeah.
And now, I'm really worried about a second wave coming.
Well, I think a lot of people are, and you think of it in terms of the flu, and I know it's got different characteristics than the flu, but there is a flu season. We're fortunate here in Arizona. It's been 100 and plus and sunny.
That helps, right?
And,
that helps.
And it's going to naturally make it difficult for the virus and the people to survive. And so, I think there is some of the summertime that'll do that, but there is some concern. But Jay, if we come and find out that there is a significant portion of the country that's been exposed, either had mild symptoms, no symptoms, or heaven forbid, strong symptoms, that they're immune to this next round that comes around. And so the spread will be less. The need to shut down, I think, will be nil. But I think we'll find some of that.
All right. So I've sent Gina her invite. I reinstalled the software, so it shouldn't go down again, but hey, anything's possible.
Yeah.
But we are talking about, all right, so we've kind of covered the antibody part. So let's move into part 2 is the worker safety part. I want Gina to definitely join us for that.
Yeah.
But I mean, so now that we know more about the science, can people get tests? I mean, are tests available?
So tests are available.
Is it expensive?
So tests are available. The one that we offer is we're going to do an auto transport intel deal.
Really?
If you go to LabCorp Quest, it's going to be about $160 or so.
Okay.
We're going to be able to get it for right around 119.
Okay.
And so
it's kind of expensive for the individual. I mean,
it's not. I'm not saying it's cheap, but it's it's not.
But that discount's definitely significant.
Oh,
Where do you go to?
So if you want to get the discount, they can call us. We'll make sure you have contact information. Our staff here will get them set up. We'll do an electronic requisition. We can get them scheduled. We'll find a LabCorp that's close to where they may be on the road, and we can go in and get it done same day. Results are back, like I said, 24, 48 hours.
So here's
those are available now.
All right, put that in there. I put that in the live chat.
Yeah, and there is. We're gonna talk about the rest of workplace. Testing's part of it.
Yeah, exactly. Testing is just part. Exactly. Like I don't plan on getting tested, but I do plan on taking precautions.
Yep, no doubt, and it works with that. And I think again, it's an individual choice. Folks, I have family members, friends, and folks at work who feel not unlike the viewer earlier chatted in and said, "Hey, I think I had this." It's good to know, and so it's really just about data.
I've heard more and more people say they think they had it. You now hear people that would say, "Well, I was really sick in February or other," and they think, "Well, maybe I had it."
Yeah.
People wonder. I mean, and also, I saw in the live chat, Ron is saying he's from the greater New York area. It's free, and he encourages everyone to get tested. So maybe in some metro areas it's growing.
Yeah, I think there are some cities that might be sponsoring it. I think I mentioned earlier, it wasn't the antibody testing, but the other that my mom had as 86. It was vulnerable population. It was free to her. And so there's areas to get it for free. And so again, you can do that if it's available. I would encourage it. The only thing I would though encourage, Jay, is as folks are considering testing, and there's a long list on the CDC of that sensitivity and specificity that we talked about. Make sure the test that you're getting. Let's make sure what you're getting and what the results are. And I'm not doubting the one in the metro area, but
good point. I see where you're headed with this. Yeah. So maybe could someone contact you and say, "Hey, this is the name of the test I'm going to take. What's your opinion?"
Sure.
Yeah.
And I can point them to. If they don't want to wait on me, Gina's going to tell you that I'm not always real snappy with my email response. But if there is a list on the CDC, I'm sorry, it's FDA. The FDA, it'll be linked at the CDC website, but the FDA will have the results of all of these tests and how they measure from sensitivity and specificity.
All right. Well, on that note, so Gina, can you see us and hear us? I think we're actually still live.
Yeah.
And I appreciate. Thank you for your patience. This is craziness. I mean, I think this show needs to get tested.
I think someone's looting your stuff.
Right.
Get off your internet.
I mean, right, exactly. I don't know what's going on, but yeah, I mean, it's reflective of what's happening.
Yeah. Right. Just chaos.
Right. It is. It's chaos. It's total chaos. So
nobody wants to listen to this crap anymore.
Well, that's what's funny. You know what? I have. Here's the good news. I have ATI community members fighting their way back in. We have people actually still here. This is, I mean, that's dedication.
Yeah.
No kidding. You got some good followers. This is your test.
I do, man. This is my.
Get back
test.
on to JTB.
I'm being tested. So,
Yep.
All right. So let's jump. Okay. So we're on part 2. We talked about some of the testing. And we've got the PowerPoint handy.
Yep.
If you tell me what slide to go to, I can pull up the PowerPoint. But I mean, what worker safety process I think of at times when I think of drivers out there trying to stay safe.
Yeah.
That sounds really hard. And how do you even know what you're doing is on the checklist of what you really need to be doing?
Yeah.
Good question. The checklist keeps changing.
Do you have a current version of the checklist, or what? How do you weigh in on
Like an hour ago, maybe.
Right, exactly.
Yeah.
I mean, pre-Antifa, post-Antifa.
Right. Right. Wear your Kevlar.
Yeah.
A Kevlar mask.
You know what? There's a great question. If you're a rioter, let's do it that way. If you're a rioter and you're wearing a mask, how you doing? Are you staying
Well,
safe?
you're not spreading the virus. You're just spreading some weird kind of love.
So, all right, I'll tell you what. Let's go at it that way. If you're wearing a mask,
Yeah.
are you protecting others?
Well,
From what is the question?
That's what I'm saying.
Are you
I
sick?
actually don't know.
Yeah.
I mean,
There
if you're
is.
sick, perhaps you should not be out.
I think, Jay, that
Quarantine.
we just saw over the last week that I believe it was the World Health Organization and then the CDC, literally on the same day, say masks were good and masks are bad.
Dr. Fauci said.
Right.
Dr. Fauci,
Well,
which really surprised me that Dr. Fauci said he wasn't sure if masks were helping.
Yeah, I think that
That shocked
especially, especially in the environment where you're going to wear it all day, you got a bandana as your mask. It's capturing all the gunk and moisture, and I'm not sure that's the healthiest way to go.
That's what I'm saying. Okay, here's what and I'll tell you what, this is good. I should have included this in industry news. I've been watching ESPN and they're doing cornhole. Okay? They're playing cornhole. There's only like 6 of them on TV. And they're all wearing masks the whole time and practicing social distancing. And I'm thinking, if nobody's sick, what are you doing?
Yeah. Well,
is it just to promote the agenda?
I think part of it is, again,
it's become a fashion.
We have heard the narrative for 2 and in some case 3 months that it's deadly, you're going to die, it spreads like crazy. And I think there is a little bit of wearing a mask. There may be some benefits. I'll encourage people to read both sides of that argument. But I think when you look at retailers or employers, some of it is peace of mind. And that's it.
Psychological.
I don't know that it's
right.
Doing a whole bunch.
Psychological.
But it's peace of mind. Yeah.
Okay, so, and the thing is that, I mean, like Ron, he's in the live chat. Now, Ron had a family member pass away.
Yep.
Mm-hmm.
So, he's going to be in that, all right, well, I'm going to follow the steps of the rule book. I'm going to wear my mask. I'm going to wear my gloves.
Yeah.
Right? And plus he's in New York City.
Right.
Right? Now, let me ask, so here's a question. If you're wearing gloves and wearing a mask, are both of those protecting me from the elements the same way? Or because I'm thinking this. I'm thinking I'm wearing gloves because I don't want to touch anything that was touched. But then we also heard the CDC change on that, right?
Yeah.
I mean, I think that the mask itself, if you listen to some of the science, it's about protecting the spread of droplets, which is how and through the mucosa, which is how it spreads. I mean, the problem, Jay, is that, this is way sciencey, but the size of the micron ends up being that it's not filtered anyway, or you get into that someone's got a mask on, but they have it under their chin or below their nose. It's really not being worn. So there's just a lot of.
That's another visual. I saw a guy, he was working with like drywall and it was very dusty. And when he took his mask off, he had all kinds of dust. Well, if the dust can get in there, right?
Yeah.
That's way bigger than the molecules that we breathe.
Right.
Yeah.
So again, you're just, it's psychological at that
Yeah,
point.
I think so. I think one thing though, Jay, that does make some sense, if you want to bring up slide 13.
Okay.
And this is where it maybe gets a little bit difficult for folks, but this is from the CDC, and I think it's some good guidance, because what this is going to talk about is when do I start or that one right there. When do I start or stop self-isolate? Right, and so we hear a lot about self-isolation. I apologize, I don't remember his name. The guy in the chat who had a family member.
Michael Collar, I think.
But if you think you've had or know you've had exposure,
Right.
and you experience